Yeah, please start the recording.
Yeah.
Okay. Fantastic. Yeah, hi everyone. Sorry for the logistic problems in the beginning. It's absolutely all my fault. I think we had some trouble with Zoom, and then I tried to fix the Zoom, and then the Zoom didn't work anymore. And then we switched to Teams, which is kind of good because whenever I talk to anyone in the NHS, they always use Teams. So maybe this is already part of learning more about the NHS. If you are, I just want to say two more things before I start. If you're in year 2 and you're thinking about doing a placement, like Labiba, for instance, did, then we have next Tuesday our placement conference. I think we have 7 or 8 students on placement or just returning from placement who will share their experiences with you guys. The whole placement team will be there. I will be there. Paula will be there. So if you have any questions about placements, I will answer your emails, but also this is the kind of and let me just admit to people, fantastic. This is the event to come to, and you can chat with us and kind of learn tips and tricks and how to do that. And then I think in November on the 20-something, I shared it, we have another talk by 3 alumni talking about how to become an educational well-being practitioner, how to become an educational assistant psychologist, and also how to become an educational doctorate. So I'll send that around, obviously. And for that one, we are using Teams as well. So that should be fine, and I should not struggle so much. Okay, so without further ado, I would love to introduce Labiba and Naima. I think I don't know much about Naima. I know a lot about Labiba because she was my student, as I like to say. Obviously, she was at City. We wrote her dissertation together, and she was my personal tutor. And I'm super happy that she came back, giving back to the community and talking about her journey. I will not say much more because I expect that Labiba and Naima introduce themselves and tell about their story. So without further ado, I would just kind of pass the mic virtually to the two of you and let you do the talking. As usual, if you, I think I'll probably at some point can figure it out. If you have any questions, you can either just put them in the chat or you can directly chat to me if you do not want everyone to see what is your question. And then I would ask Labiba and Naima to the question. I think Labiba and Naima, if it's fine, I would just like, if I feel like, oh, this would be really good to interrupt here, I would just do that, I think, yeah?
Yeah, sure. No
Okay,
problem.
that sounds great. So please take it away.
Hi, everyone. As Andreas has mentioned, my name is Labiba, and I am a psychological wellbeing practitioner in Havering Talking Therapies. And I was an undergraduate student at City University of London. And Naima, do you want to introduce yourself?
Yeah, I'm Naima. I'm a senior psychological wellbeing practitioner. So I've just been started in Havering quite recently. But I trained with Redbridge Services as a psychological wellbeing practitioner.
I think you're a bit quiet, Naima. I don't know if it's just my end there.
Yeah, just give me a second. Teams wants to act up. Okay.
Yeah, it's a little bit quiet. If you, I don't know if there's a chance to
try with my headphones. Give me a second.
Okay.
Can you hear me now?
It's about the same. But I can hear you. If what were you saying? I'll let them know if anyone can't hear.
I think we can hear her. It's just a little quiet.
Oh, okay.
Is that any better if I speak louder?
Yes, that's good.
Yeah.
That's good.
I was just introducing myself. My name is Naima. I'm a senior psychological wellbeing practitioner at Havering. So I've only actually started quite recently into this role, but I trained and qualified as a psychological wellbeing practitioner like Labiba, but with a different service, with Redbridge Service. Yeah, lovely to meet you all today.
Perfect. So we'll get started. And today we just wanted to talk about our journey onto becoming a psychological wellbeing practitioner. I think firstly, I just wanted to put the question out there. Have you ever guys heard of IAPT before or talking therapies? You don't have to come on the mic, you can just put it on the chat. Yep, I can see Claire said yes. Yep, a few people have heard. That's good. Andreas, yes. Oh, that's great. So you might know some of these things already about IAPT. So just to start with, IAPT stands for Improving Access to Psychological Therapies. And it was founded as a result of identifying that industry was losing a lot of money from sick days and thus developing a service to support people with low mood, stress, anxiety, and other common mental health disorders in the hope that it would benefit the economy. And IAP services are built off the foundations of CBT, which is administered by a talking space to discuss coping strategies that can be used to manage anxiety, depression, and other mental health disorders that are quite common. So I'm sure you guys have become familiar with CBT through, some modules. So we work alongside a lot of services, and they include GPs, intervention teams, substance misuse services, social care teams. In a sense, it's, we work in a multidisciplinary way. So I don't know if anyone's heard of the term multidisciplinary, but it's basically saying that, you work together as a team of health and social care professionals, and I guess beyond as well, like, for example, voluntary sector organizations and other organizations in the community. So we all work together to basically help clients in our services. So in terms of IAPT, we follow a stepped care approach. And PWPs, we work at step 2. So that's the low intensity cognitive behavioral therapy. Has anyone heard of the stepped care model before of IAPT?
I have not.
I think some students have actually heard of it, which is great. And I think we covered this in one of the modules quite briefly. I think it might be one of Anne's modules actually. Okay, well, for those of you who don't know, this is what the step care model looks like briefly. So there's step 1, which is normally when clients go to their GPs and they present with symptoms of, for example, anxiety, depression, or, other mental health disorders. And the initial sort of step that GPs might advise is, sometimes medication, depending on how serious it is, or sometimes talking therapies or other ways that they can, manage their health better. So if, for example, GPs or other healthcare professionals, or even the clients themselves, feel like they need further support, and they'd like to speak to someone about what's been going on for them, they can refer themselves or be referred to our service via, GPs or other ways, or self-referral. And we would work with them in terms of, like, we would assess them first, and then we would provide treatments in the form of groups, one-to-one sessions. But also, I think sometimes we do work alongside GPs in the sense that clients would still have, they would still be taking medication on the side as well sometimes. And also, for example, other services, if that's helpful, sometimes we might refer them to social care if there's aspects of, their situation that need to be addressed by social care. So that's step 2. Step 3 would be the next step in our service, which would involve high intensity psychological interventions, which basically are based on CBT, but they are basically, longer sessions and for a longer amount of time to provide basically a bit more, I guess, intense treatment for people who are still not recovering after step 2. And then we have step 4, which is usually, quite intense treatment in the sense that it involves a lot of different forms of treatment, but I'm not going to go into that because it's not sort of relevant for PWP's as such. So, oh, I think someone said, okay, sorted out. So what is a PWP, or Psychological Wellbeing Practitioner? Has anyone heard of this before or come across one? Yep. Good. So it sounds like some people are familiar. Does anyone want to come on the mic or put in the chat what they understand about what PWPs do? Andreas knows several.
Do they give like low intensity CBT to people with like anxiety or depression problems, but like they don't have like major problems, and it's kind of structured like a few sessions, like not too many sessions?
Exactly. You've hit the bullseye. So yeah, as you said, it's low intensity CBT, which basically is aimed for people with mild to moderate, depression or anxiety symptoms mainly. And we try not to give them too many sessions, just to, give them enough time and space to be able to manage it on their own. So when clients come to us, they have to be quite sort of able to manage things themselves as well, without relying on the clinician as much. So if we look at the formal definition of PWPs and what we do, we basically support individuals with mild to moderate common mental health disorders by providing them with coping mechanisms and strategies to help them manage their difficulties. And this can involve, triages. So initially when clients are referred or they self-refer, they go through a screening, and after that, if they're suitable, then they would be triaged. So after the triage, we would then decide on whether they would be appropriate for our service or we'd need to refer them elsewhere. And if they are appropriate for our service, we would put them on a waiting list for assessment. And then obviously after the assessment, you start the treatment as well. So some of the treatments are delivered via telephone, some of them are face-to-face. So during COVID, as you guys know, a lot of things have moved to, the virtual world. So we were doing some therapy sessions over Teams or Zoom, some of them over the phone. But now I think as we're moving towards, I can't say lower cases of COVID because it's rising again, but we've moved out of that phase of COVID. I think we are trying to see people more face to face in the office. Sometimes treatment is delivered in group settings. So we do have a lot of groups in our service, which I'll be talking about a bit later. And there's also online CBT as well. So that's delivered via modules, and clients work at their own pace, and it's not so rigid in the sense that they don't have appointments put in place. They can work on the modules at their own pace, which are designed for treating their difficulties. And yeah, you'd be doing like reviews with them every weekly or every fortnightly just to see their progress. And when you qualify as a psychological wellbeing practitioner, your caseload might look like a mixture of the above, and you'd usually have a caseload of maybe 30 clients, more or less, which can be, broken down to 6 daily clients, basically. And PWPs have a, I guess, very exciting career progression in the sense that there's always things you can do, always trainings you can take, and there's progression opportunities to becoming a senior PWP such as Naima, and moving on to high intensity, but again I'll cover that later. So what does the day in the life of a qualified PWP look like? So these are some of the things you might expect when you're qualified. So you'd be doing triages, assessments. The difference between triages and assessments triages are basically an overview. They aim to get an overview of what's going on for the client. It's not detailed assessment as such. But obviously it does involve many of the aspects that you would find in an assessment. So for example, risk assessment is something that we would always have in our assessment sessions, our triages, and our therapy sessions. So yeah, a lot of our work is, risk management as well. So you'd have therapy sessions, which I mentioned, it can be via telephone or via face-to-face, or via online Silver Cloud, or they can be through groups as well. There's also admin work that you do, which is, I guess, with every job, and also note keeping, as you guys are aware, is very important in the NHS, for your own record and obviously for the client as well. There's a lot of team meetings as well. So there's, particularly in Havering, we do have a lot of team meetings. So I think it really helps to get everyone together and share our ideas and opinions as well. So we have like monthly team meetings where the whole team gets together. We also have PWP team meetings, where it's just the PWP team. We also have like clinical skills sessions where we can sometimes get external speakers to come in and deliver training. Sometimes it's one of us delivering the training. So a lot of, I guess, trainings available. You'd also have frequent supervision. So when I say frequent, case management is every week. And you'd be taking your cases to case management supervision to discuss them and basically make sure everything's fine with them. And then you have line management supervision, which is basically, your line manager who checks up on you and sees, the workload is manageable, because sometimes, it does get a bit overwhelming. So they basically do help you to sort of keep things manageable and work towards, your goals, really. And optionally, some people can take part in link work opportunities. So for example, we have people who are perinatal link workers in our service, or BAME link workers as well. So we work with these services just to increase accessibility and just see if there's any opportunities for collaborative working. I know I've talked for a long time. I just wondered if anyone has any questions so far.
Could I ask a question, and then
Yeah.
we can come back to that to kind of contextualize? I think you said you have about 6 clients per day. My initial reaction is like, yes, it's like just a good question from Marvina. I'll ask it in a second. It's like, that's a lot, isn't it? I think it seems like a pretty solid amount of work. If I think I have to have 6 student meetings plus like notes and teams, and yeah, how does that like for you being well-being practitioner? How does it feel? I think Marvin asked about, do you work with children? And then I'll see what Katie asked in the chat as well. Yeah, okay, about research, okay, but maybe, yeah.
Sure. So I know that might have scared a lot of people. And I think in terms of the treatment sessions and the assessments that we offer, we aim to keep them. So for example, for triages, we try to keep them to 30 minutes long. For assessments, we are advised to keep them at 35 minutes, but usually it takes longer than that. So you can expect maybe 35 to 45 minutes for assessments. And for treatment sessions, they're supposed to be 30 minutes long. So in that sense, in a perfect world, then, it doesn't seem as much. But I think when you have that variation of having triages during the day, having assessments, and having therapy sessions as well, it can bring that variety as well, because sometimes, it can feel quite monotonous and quite difficult, but it's also quite exciting having that variety. But also in terms of managing and how you manage that, it's completely up to you. So we do have that flexibility of you managing your day, you managing your week. So whatever works for you, then you're welcome to do that. And I think you just agree that with your line manager as well. And there's normally not any issues in regards to that, because everyone works differently.
Okay, that sounds great. Yeah. I think Lucy raised her hand, and maybe is it like Labiba, maybe you could quickly answer. Do you work only with adults or also with children?
Sure. So in IAPT, in Psychological Wellbeing Practitioner world, we only work with adults, but there is a role for children as well. So they're called Children and Young People's Wellbeing Practitioners.
Oh,
Naima,
interesting.
correct me if I'm wrong.
If you can hear me, yeah, no, that's right. It's called CYP.
Yeah.
And then we're going to mention there's also the education.
Yeah.
Mental health practitioner as well, and those specifically focus on working with children and young adults.
Okay, interesting.
And Katie's one, sorry.
Yes, go ahead.
Were you going to say something?
No, and just like I think Lucy raised her hand.
Yeah.
There's a question about the application process, and then Katie asked about research. Yes.
Yeah, so with research, definitely you have room for research or audit or service user feedback. Definitely there are opportunities for that, but I think it depends on the service as well. I know that there are these opportunities in our service, and every service has some sort of service user involvement project going on, and audit. So I think it's just dependent on the service and stuff. Will you be covering the application process? Yes. And I think Lucy had her hand up, so Lucy, do you want to come on the mic?
Yeah, with that 6 client a day, I don't think they will always have all the clients have the same meeting process. For example, some of them might be on the first meeting with the client to assess to determine if their psychological therapy might be helpful, and some of them might be in the other processing, for example, to see if the therapy is working or not, which is I think shorter than meeting someone for first time. So I think the there will be some long interviews with clients, and some of them might be shorter in total clients a day. Is that how it is, or they all long?
No. It entirely depends on the client. So it's definitely not the same for everyone. Sometimes it will be less than 30 minutes. You'll get to the hang of it once you qualify, and you can do that under 30 minutes. For sometimes you might need a bit longer, but it's not long for every client. I think it just depends on what you're working with, who you're working with, if they present with any other difficulties, because sometimes clients might have slight learning difficulties, or they might have autism, so you might need to put some adaptations in there, which might make it a bit longer. Okay, no problem. We will have time for questions at the end, Andreas, I hope.
Yes.
So
it's your time.
Yeah. No, I'm just mindful in case they have a lecture to go to or anything. So what qualification do you need to become a PWP? So you will need to complete the low intensity CBT PG certificate course. And I think in London, it's normally UCL that we work with. There's also Essex as well. I'm not sure if we work with Essex, but UCL definitely we work with. So you'd be doing basically the PG Cert course and the training in our service simultaneously. And the certificate provides you with the formal training that is required for you to qualify as a PWP. And the training is, as I mentioned, is a combination of teaching at UCL, where there's directed practice, learning, and clinical practice, all under supervision. So once you are on the course, you'd have a training contract as a trainee PWP within an NHS IAPT service, where you will be delivering the low intensity CBT sessions. And the good thing is, that these courses are funded, and you'd also be paid a salary whilst you're training, as well as obviously when you qualify. So normally the funding for a trainee PWP role is 1 year fixed term contract. So is the course. But you finish the course normally, I think, quite earlier than a year. So maybe I think 8-9 months in, you'll be finished with the course. So yeah, you'd be appointed at Band 4 as a trainee PWP. If you know about the NHS Agenda for Change pay scales, you'd be on Band 4. And when you successfully complete your program, you'd be moving on to become a qualified PWP at Band 5 for an interview process. So just a bit about the course with UCL. I personally didn't train with UCL. I did it with UEA, University of East Anglia. But UCL, I understand, is initially 3 times a week you'd have to attend the lectures and seminars, and you'd have 2 service days where you're working in the service. That's initially in the intensive block, but then it becomes 1 day a week where you have to attend uni and 4 days in the service. So in terms of what content you'll be expecting to learn at uni, they'll all have, a theory-based evidence about low intensity therapies and obviously research and how to deliver that therapy, how to carry out assessments, and obviously the theory behind the work you'll be doing as well. And within the service, obviously, you'd be able to shadow the qualified PWPs, and you'd have weekly sort of reflection clinical skills sessions where you all get together and share what you've learned and, I guess, bounce off ideas. Yeah, I think that's that. I think, yeah, the other universities are UEA, Essex, Southampton, and D Montfort, as far as I'm aware. But with Havering, with our service, we work with UCL. Okay, so now moving on to the application process. You apply for the trainee PWP role, and with UCL, you apply via the university website. Is that correct, Naima?
Sorry, say that again for me.
No, I was just saying with UCL, you'd apply via the university website.
Yeah, so it's kind of when I applied, it was a little bit different. So you actually only applied through like NHS or track jobs. It's best to just keep an eye on
Yeah.
the UCL website, just because sometimes they require you to apply through both. So yeah, so
Okay.
sometimes you can apply through both, sometimes it's just through one. But they do put the posts out on NHS and track jobs most of the time.
Perfect. So yeah, when I applied for UEA, I think I did it via the NHS jobs. So yeah, I would keep an eye out on the universities and NHS and track jobs. You can set up alerts for these kind of roles as well. So there are intakes each academic year starting October or February. So I think with UCL, there's 2 cohorts. One starts in October, one starts in February. So I think the applications are going to be opening soon for the February intake. So obviously after you apply, candidates are shortlisted for interview, and then if you get put forward for the interview panel would consist of a university lecturer or a supervisor, the PWP team lead from the service, and also the service manager. That's how I had it. And there would be, asking questions that assess your clinical competency, your clinical knowledge, knowledge of safeguarding and risk, which is very important, and your ability to carry out reflective practice. There may also be, I think, some scenario-based questions or role play, but it will be quite brief. So now just moving on to entry requirements and what you might need. So you'd need a minimum of a 2-2 in the UK undergraduate degree, but sometimes they do accept applications from people who've got equivalent standard of qualifications, along with work experience and achievements at work that would demonstrate the ability to study at a postgraduate level. But I think for you guys, it won't be relevant because you'd always, you're all studying a degree. in terms of experience, they'd be looking to, see people who've got experience with people who are suffering from psychological problems, with interpersonal or social problems. And they can be in the form of paid work or voluntary or honorary work. And examples of that experience might be support worker role, assistant psychologist, healthcare assistant, mental health worker, social prescriber. And yeah, you'd be basically expected to reflect on your experiences and understanding of mental health issues and the ability to form basically a collaborative and therapeutic relationship with these people. And yeah, you'd be expected to have that understanding of how the NHS primary care and mental health services would work. Of course, you need to have excellent and excellent written and verbal communication skills, because you'd be doing some assignments as well. And yeah, I think the last one, you'd need to have computer skills, because a lot of your work would obviously need to be recorded when you write notes and stuff, and you're writing sort of other reports and stuff. And I think something else that's quite important is actually the ability to use clinical supervision and be able to reflect in a constructive way and use that to basically aid your practice in the future.
Could I just jump in for a moment?
Yeah.
I think there are tons of questions about this. And maybe I just ask you the question so you don't have to worry about the chat. I think there's something, how competitive is it? I mean, it's hard to answer, but it's just from do they ever present you with numbers? How many people apply? How many people get in? And if so, do you remember those numbers?
Yeah, I think when I did the interview, but the team lead actually told me, I think it was, I remember correctly, it was there were 252 applications, and I think 6 people got taken.
Okay.
Actually, I don't know how many were shortlisted. So if you can translate that into,
a fourth of the people that apply. Yes. Okay.
Yeah.
Okay.
It is quite competitive, but I also think it's not as competitive as the doctorate, for example, maybe. And how do you prepare for such interviews? Sorry, go on.
Yes. Yeah. How did you do it? Yes.
How did I do it? I think Andrea said before that I did a placement year as an honorary assistant psychologist. At that time, I didn't actually know what PWPs were. So there was that experience, and then after, I also did a bit of sort of research work with Professor Philip Cole. What else did I have? So after I graduated, I briefly, not briefly, sorry, I worked as a social prescriber for around I think 8 months, as well. But yeah, even at that time, I wasn't very knowledgeable about the PWP role. But I don't think you need so much experience. I think if you're able to reflect on your experience, because I didn't do it for the sake of getting the PWP role. But I think if you're able to reflect on your experiences and what you learned from there, then I think that's the most important bit. Yeah.
So yeah, I think, I mean, there's another kind of I don't know, Naima, do you want to jump in?
Yeah, I would like to jump in. So I'd say preparing for interviews, that question specifically. When I prepared for my interview, I would say a lot of the time I spent a lot of time doing research, just online. I wasn't very well versed in what PWP meant, or IAPT, or step to care model. I think you guys have a little bit more information on that, so you guys are already ahead of the curve already. There's a lot of information online. It could help if you know anyone who is a PWP to kind of support you and kind of give you some idea of what they do ask, as well as using, I guess, the job spec and the job description is really helpful in that case. I wouldn't say you need to know a lot of clinical knowledge. Like any other course, it is a training course, learn on the job. I would say that, yeah, like Labiba mentioned, it comes back to how you are able to reflect on your previous experiences, and whether that's volunteering or whether that's working, it's about how you're able to reflect back and express that in the interview, in understanding how the NHS works, and how we deliver our interventions to some extent.
Yeah, if I could just like, I think it's really good to not just like what do you need, but I think just kind of what you can do if you graduate, you still, for the next 3 years, you can still access our career service and ask them to help you prepare your application, look it over with. I think Antonia, Angeli, we have spoken to many people who applied, who were in the job interviews, what they experienced, what type of questions they have, what they're looking for. So I think getting feedback from a lot of places is really, really important. I think ideally, if you do, for instance, a placement year, you have a relationship maybe with the people that work there, and they can help you, can chat about this, and they give you a lot of insight. Talk to your personal tutor, talk to your career service, talk to Antonia, and they will all help you to be really well prepared for that. I think it's just, experience is one thing, but I think most of the applications I see when our students reflect of my personal tutors that sent that to me, I think like, we need to work a little bit on that. I think I've never seen any application that was sent to me where I thought like, oh, great, let's just submit that. So I think get feedback on your applications and your chances will be dramatically better than 1 in 4 because you will do much more work than most of the other applicants are doing. So I think that's good too. So I don't know, like I think, Labiba, there are many, many questions about this. I don't know, like, do you want to first, because I see you have like 9 slides left. Do you want to finish your talk and we talk about the questions then? How do you want to do it?
Yeah, I think if we maybe finish, I think we'll have some time for questions, so maybe that would be good. Feel free to put your questions in the chat. We'll definitely get around to doing them. Okay, so what does the learning or the teaching look like from university? So the program itself, the course with the university, is 45 days in total. 25 of these days are university based, and the additional 20 days are called directed study. So basically, they are days where you'd not have lectures or not have really seminars, but you'd have tasks to do. So you'd be expected to be working on those tasks, for example, carrying out interventions on yourselves and reflecting on them and writing a blog post, doing some research on, I think, quite a few things. Sorry, I can't remember exactly. But yeah, you'll be expected to do reading, a bit of research, but I think it's fun. Like, I might be a bit of a nerd, but I think I found it quite fun to have those directed days. It helped me to process what I was learning and actually apply them. Because sometimes when you think about how clients feel when they're having these treatments, it's hard to know if you haven't really been there sometimes. So it's good when you do, apply these things to yourselves first. Yeah, so all of the sort of learning would include lectures, workshops, skills practice, seminars, directed reading, and e-learning. And there's 3 core modules, and they're all compulsory. So one of them is recognition, in other words, basically assessing the psychological difficulties that the clients present. The second one would be on recovery, so the treatment, basically. And the third one is a module which is based on diversity and working with diversity and increasing accessibility, which is obviously something that's quite important in clinical psychology. In terms of the assessments, there will be sort of written and oral assessments. There's something called OSCEs. Some of you may have heard them in terms of from the medical field, but we do have OSCEs where you'd be doing an assessment with a pretend client. So they would have actors in place, and they'll be pretending to be your client. So they'll be given obviously like a script of what to say to you, and you'd be carrying out an assessment with them. So that's for one of the oral assessments. The other, there's 2 other oral assessments, a similar one for treatment as well. So you'd be given a pretend patient and you'd be doing a treatment session with them. And obviously they would be assessed and you'd be marked. And then the third oral assessment is with a live patient. So that's an actual client that you'd be working with, and you would select your client based on some aspect of, I guess, adaptation. Sorry, adaptations that you've made to show that you are able to incorporate those things into your practice. Written assignments would include exams, essays, case reports, clinical logs, and reflective accounts. So yeah, all of them would need to be passed and would contribute to your overall award. In terms of career progression, you can, whilst you're in the PWP role, you can specialize in certain areas, for example, long-term conditions, perinatal, for example, working with the perinatal population. And in terms of beyond the qualified PWP role, obviously you can move on to become a senior PWP. I think you need a minimum of a year's experience for that. You can also then move on to becoming a IAP team lead or a service manager eventually. There's also high intensity training, which is basically something that you can apply to after 2 years of working as a PWP. Some people might go into nursing, teaching, speech language therapy, social work, and some people eventually move on to the doctorate in clinical psychology. And I know there's a few questions about the doctorate, and I will answer that. So just briefly, working with us and what that looks like. So in our Havering Talking Therapies team, we have a large and diverse team of 80 people, and they're all from multiple professional backgrounds. And we have obviously PWPs in the team. We have high intensity therapists, counselors. We also have a counseling psychologist in the team as well. And obviously we have trainee PWPs, honorary assistants as well, and therapy assistants as well. So there's quite a variety in the professions in our service. And I would like to say that we are quite diverse. There's a lot of sort of people from different backgrounds in terms of experience and ethnically as well, religion as well. In terms of our office, we're based at the Petersfield Centre, which is 10 minutes from the Havering train station and has links to Romford, Stratford, Liverpool Street Station. Good to know. And yeah, I think that's sort of what I want to say on that. I have talked about that before. So why would you work for Havering IAPT? We offer flexible working, so we do have remote working opportunities, and currently we are expected to come to the office 1 day a week minimum, and you could be working from home on the other days as well. There's a varied caseload, as I've mentioned before. It doesn't just consist of assessments. It doesn't just consist of therapy sessions. You can have other things added to your caseload. And I guess obviously specialize in different areas as well, as I mentioned, with the perinatal sort of link working opportunities or other link working opportunities. Also, we have a lot of, staff wellbeing events being put into place. So we have a wellbeing lead who's quite responsible for looking after, our mental health as well, while we focus on the mental health of patients. We have reflective spaces, so they are for non-work related rants, you could say. Sometimes you might be having a difficult day and you just need to speak to someone, so that they're in place as well. And we do have events like social events every now and then. We have a high retention of trainee PWPs after they qualify. So I guess in that sense, we're quite good at getting you guys to pass the training as well and secure a permanent job after that. And I think I mentioned this before as well, we do have quite a lot of training opportunities and development opportunities as well. And we're one of the best teams in Delft. Actually, we are the best team in Delft. And I'm not just saying that because I work here, but it's actually a proven statistic. But yeah, I think that's the end of our presentation, really. So I think we can move on now to questions.
Yeah, maybe we just stop sharing. I think that's always a nice if you don't. Thank you very much. I mean, this is what I always feel like sucks the most about virtual events, that there's no clapping, no actually real expressions of gratitude. But thank you so much. Yeah, we have tons of questions. I think one to kind of summarizes, I think, and is the kind of tricky relationship with the doctorate, because, and I think maybe, so the first time I heard about it was like Shah, he was in, like, he's a City alumni. He said, well, I did first the PWP, then I became a high intensity, and then I went on a doctorate. And I know that a lot of my former students kind of went into PWP because they want to get a paid way of getting the work experience to get into the doctorate, right? Nothing wrong with that, right? But now I think there's like, I think with Mohammed, whom you know as well, I talked about, and there's like, oh, it seems the NHS is not happy about that so many people are leaving for the doctorate. And maybe now you can fill us a little bit in. What is the kind of relationship there? What are there new rules in place? Will there be, yeah, maybe you can talk a little bit about that. That would be great.
Yeah, sure. So I think I will quickly address Marvin's question, which is how is a PWP role different to an assistant psychologist? I think in the sense that you'd have a bigger clinical caseload, so you'd have a lot more clinical experience with patients or clients. You'd be doing quite a variety of things. I think sometimes with assistant psychologist roles, they, you know, you'd be doing assessments and they are quite supervised. Whereas here, and it can be quite limiting in the sense that how much you can deliver, like how much therapy you can deliver, because you don't have a sort of therapeutic training before that, I guess. But obviously with the PWP role, you can carry out assessments independently, you can carry out therapy sessions independently. Obviously you'd have case management and supervision, but I think it's more so just to check that everything is just, you know, being done correctly, and just to check in if there's any issues and such. So I guess there is that independence there. And I think, again, this brings it back to clinical, like it's very clinical based. So there isn't, you know, very much opportunities for, I guess, research or audit, but that is something that's possible, because obviously with any mental health service, I imagine that they would want to improve their services. So there's ways of doing that in the service. And yes, obviously another way it would differ is you'd need that training to work as a PWP. Whereas with the assistant psychologist job, you wouldn't need like a year of training in that sense. Naima, do you want to fill in if you feel like there's any other differences?
I would say that one of the differences is that with the PWP role, I hope you hear me, is that we work primarily with all sorts of adults and all people from different walks of life, but they're all presenting with similar problems, which is anxiety, depression, stress, panic, OCD, a range of things. Whereas with an assistant psychologist position, you work in a range of different services. So you might work in a more clinical inpatient setting. You might work on like an early psychosis intervention team. You might work in a dementia or in a memory service. So the type of people that you work with will be very different with assistant psychologist jobs, and then of course, dependent on that, your caseload and your responsibilities would be quite different too, and the kind of range of experience would be very specific to that community. Whereas working as a PWP, you get like a very broad, I guess, range of experience.
Thank
Great.
you.
Yeah, Labiba, could you, so maybe you avoided a question, but could you tell us a little bit, like, how is it, are you, like, once you're finished, are you allowed to immediately apply for, I mean, allowed for the doctorate, because now you have the experience, you have this 1 year clinical experience with a degree that you need in order to get onto the doctorate. So after you finish basically your like training, you can immediately apply for a doctorate because you fulfill now all the criteria that the NIH has. So what is happening in that space?
So I think last year there was a big issue about this actually, where they had said you wouldn't be able to apply for the clinical training until 2 years after you've qualified in that role. Because it's already, you've done an NHS funded program. But I think this year, because of, all of the people that have rightfully sort of protested against that, I think they just extended that until the end of, I think, February this year. So after February, if you apply to any NHS funded courses, you would basically be expected to wait 2 years post qualification before applying for another NHS funded degree. And that's not just the doctorate, that's for anything else. So for example, if I started in February next year, I wouldn't be able to apply for the doctorate until 2 years post qualification. But yeah.
Okay, so yeah, okay. There seems to be tension between these two, and who knows, this might change again or not. It feels like something that's hard to uphold for the NHS. They're probably trying. I mean, understandably so, to educate you, and then it's like, oh, now you're leaving us after we trained you for a year. I understand the NHS perspective. Also understand the perspective of the people who want to get onto the doctorate. So it's a tricky space, but I think it's important to know, right? If you're kind of considering whether you want to do it. I suspect that you might not know either, but international students, are they self-funded? How does that, can you be a non-British citizen and be on the Psychological Wellbeing Practitioner program? I think if you're a doctorate and you're not British, you have to pay. So you're self-funded. And so how do you know that? I couldn't find anything on the UCL page. It's like, I don't know, Labiba, do you know anything?
I think PWP programs are all NHS funded, so it would go under that criteria as well, unless I don't know something about, non-funded or self-funded PWP courses. But I think the same thing, like if you apply for any NHS funded course, it's not just limited to PWP and doctorate. It's if I now went on to apply for the clinical associate in psychology training, which is something else, I don't think I would, if I had started the training now, I don't think I would be in a good position to get a chance because I haven't worked 2 years post qualification. But Naima, do you know anything different about that, about international?
I think she said in a chat.
Okay.
But I've had a few questions about that recently as well, a few other events. What I can do is I can email the course tutor at UCL just to find out more information, and I can forward that to Labiba, and she can let you know, Andres. And
yeah, I can also just send them an email. That might be the easiest, right?
Maybe.
If I just ask UCL and then I can share that with my students, that might be the most direct.
With them, because they will have more information on that. Unfortunately, there's just not a lot of information on it online.
Yeah. Okay. So we talked about kind of, I think there was one question about when can you apply, when should you apply? I think UCL, they start the first program starts in October and the other one in January or something around these times, right? They don't have any at the moment, but you can apply if you are expecting to graduate in your third year and graduate. So you can say like, oh, I will graduate in June and I want to start the program in October. you can definitely do that, right? There's no, like once you have all the criteria, once you have some experience, we have your degree with the 2.2 or higher, you can apply. Yes, there's that. And right. Let me just go through.
The experience as well, because sometimes people have the degree, but they might not have the experience. But I'm assuming that, obviously, if you're going to apply straight after graduating, you'd have some experience then. It doesn't really,
Yeah. I think like if you have no experience, it will be tough. Then you would have to basically, like if you graduate and it's like, I didn't volunteer, I didn't do a placement, I didn't do anything. You have to first fill that hole and get your feet wet. And once you did that, then you can apply.
Sorry,
Yeah.
Andres, I just wanted to add as well, though, that there are people who come from different backgrounds and from a different host of experiences. You might be a mature student, or you might have some life experience in some other ways of like supporting vulnerable people, whether it might be a grandparent. I really think it's just about how you convey and come across with that information too. Of course, it does say, please do have some experience of working with vulnerable adults. But when I was training, I met people who were teachers, who'd come from finance. So they'd worked with people in a range of different settings, but it was about, their passion and why they wanted to become a PWP. And I guess if you can convey that why, that can really be helpful in expressing that.
Yeah, I think that's a really good point, right? Sometimes like don't wait, right? In some ways, apply and then get rejected, and then yes, it's like, and then you're kind of primed to with the questions and thinking about these things when you go into your volunteering experience, or if you start working as a mental health support worker or any other role, you know what you now are looking for. I think don't say like, oh, yeah, I mean, writing applications is not fun. Nobody likes to do that. So, but think of your future self. That will be your future self will be very grateful if you already applied. So don't stop. But I think it increases your chances dramatically if you have some work experience. And I think it also kind of highlights that you actually care about the things you say you care, right? I think this is, like, I really care about vulnerable people, but I never work with them. It's just hard, right? Yes. Okay. Yes, I think.
Sorry. And I was just going to quickly make a point that I think Naima made a really good point, like obviously if you have experiences with people in other settings as well, then that's fine. But as long as you can sort of relate it to how it might help you and, what it's helped you to learn, as Naima was saying, like why, what sort of made this useful for you and how can you use that going forward? I think reflection is quite key in the statement.
Yes, I think it's a similar. I think there's a question about your personal experience of supporting someone with mental health problems. Yes, I think it's exactly what Naima says, right? She's like, maybe you can't volunteer because you either study or you go home and support somebody. People will be open to that. There will be, there's nowhere to go, oh, look at her. Why doesn't she do that? But I think the other thing is then, and this is what Labiba says, but if you ever talk to career service, say what I say, you have to kind of reflect on these things, right? If it's just, you have to kind of show that you transcend a little bit the situation and think about what is happening, what works, what not works, how the content you learned in the 3 years here at City ties into that. I think it's a really, really important process. So yeah. Okay, I think that was amazing. Thank you so much. I apologize again for screwing up the Zoom thing. I should just, stop using computers. And I just want to say thank you so much, Labiba. Thank you so much, Naima. It's wonderful to hear about that firsthand, about these events. It would be great, Labiba, if you could share the recording with me. I think it might be in the chat if I could download that. And then, yes. And yeah, have a wonderful day. Thank you so much.
Awesome. No, thank you so much for having us. And thank you, Anne, for coming. It's lovely to see you after so long as well.
All right.
Thank you. Thank you, everyone.
All right. Labiba, where do I find the record? I think you can maybe stop the recording.
Yes, let me do that. And also, Andreas, if obviously anyone asks any questions and